Why did I purchase a CAT scan? 2 years ago, in January, I had a physician sent me a patient with cancer. The patient was on the way to Germany for cancer treatment, and the physician said, make sure there are no infections. State of the art, I thought. So I took full mouth digital x-rays. I looked, a mouthful of PFMs, and didn't like that, but didn't see any infections, didn't see that part of it. Said, you know, there's one CAT scan in Oklahoma that you may be interested in. Well, they jumped on it and went and got the three-dimensional CAT scan, and the doctor called me and said, oh, there are 3 abscessed teeth. And I said, get out of here. Went back and looked at my digital x-rays, still didn't see them. So it then became a moral issue for me. Okay, if I have patients come in, and particularly if they're referred by a good naturopathic physician or a holistic physician, and they say, get rid of the infections, and I know in my heart and also intellectually that there's a tool out there that's better than what I have. A slight thickening of the periodontal membrane space. Don't really see something. Again, you guys can beat me up about the quality of the x-rays, but sometimes that's what I get. That's an abscess. Look at this. Small abscess here. Look at the sinus. Is that an accident or is that unrelated? Probably not. Which is easier to diagnose. Little lesions here, or you look over here, pretty easy. A lymphoma patient, look at all this. Look at this. This is that same patient. Look at the lesions here. Look at the lesions there. This is a patient I'll talk about. This is the patient that we have, that we'll look at in depth. Uterine cancer. There. Results. I have seen amazing results when the oral cavity is treated as part of the problem. I studied a lot with Dr. Omura, who's an MD, and his belief is that all disease, including cancer, is simply an infection. Well, if that's true, and I started studying with him 15 years ago, that still seems true to me. So if that's true, then one of the things that we need to do is to find, you know, where is the infection and what's going on. And the CAT scan is just an incredible tool to do that. All right, is this an abscess here? I don't really see one. Blow it up a little bit, you can think, oh, I don't know, is it? I don't see it. This is a 3D CAT scan. This, I don't see that this often, okay? But sometimes you'll see this. Sometimes you'll see this. What I sometimes tell patients when I'm going over the CAT scan, I say, let's pretend that this hand is your root of your tooth, and this is bone. Ought to look like this. If it looks like this, something caused that. You know, I've spent a lot of time looking at the whole body. You know, I've spent the time with Dietrich and Dr. Omura, and I went for almost 10 years of spending at least 40 days a year in CE. Omura's belief, we've talked about it, cancer is an infection that thrives in the presence of heavy metals. This patient that I'm going to show you, breast cancer, I think she came in just last month. Metastatic lesions already to the sternum. Look at the first molars. How would I treat this if this were my wife? I don't know. I don't think it's over. I don't care if she's got a metastatic lesion to the sternum. I don't think her life's over. Look at the lesions here. Again, you've got to look for them, but they're there. Look at that. You've got to look for them, but they're there. Surprise, surprise. Root canal treated tooth. So again, everybody's going to have to decide if this were you or your wife, how would you treat it? I mean, some people would, oh, I had a patient in about a year ago, didn't really believe in what we do, drug in by sister-in-law, brain cancer, getting ready to go somewhere else. I called the physician and I said, we have some infections that were found on the CAT scan, and he said to me, almost verbatim, let's not bother. He only has 4 months to live. So, I mean, there will be those people out there that will say that. You know, actually, he would not let us treat him, this guy. He really never bought into this, and he didn't last 6 months. Went to Germany and did some things, but still did not survive. All right, look at the stuff here. It's small, and you guys can argue with that. What I want you to do is get your, all right, where'd we go? I actually had to scroll in and out of this so I can see that. Did I just lose the mic? No? Where are? All right, same patient. Look at the sinus membrane, small lesion, and look at this. There's some reaction to that. Floor of the sinus here is eroded. There's another one. Okay. I've only had a couple of patients that have showed up with biocalyx, and I'm not picking on biocalyx. I'm just showing you this is what I saw. This was 18 months ago. If we look at it in the axial view, we can see, you know, that this guy's failing here, or never was successful. Look at it here. Look at the lesion here. Not again. I mean, how often do I see this? Look at the lesion. Look at this right out here. Okay. All right. Look at this. Look at the cortical plate. See how it's perforated right here? So here's an axial view. Now look at the cortical plate on this side. It's intact. Look at that right there. It's not. These are, I mean, you absolutely cannot find these with digital x-rays. And even with a 3D CAT scan, you know, if you guys had one within a month, you'd be able to do this. You can look at these, but you can see things you just can't see anywhere else. Okay, look at the lesion here, and look at the lesions here. And look at the lesion here. Again, and you can see a little bit of root canal sealer out here. The nice thing is you can see it, the patients can see it. How often have we all heard, it never felt right, I've been to 2 dentists, they tell me they've taken x-rays, and it's okay. How often have we seen the patient said it never felt right, digital x-ray, don't really see anything. Look at the bone here. Pretty big lesion, and that may be why it didn't show up very well. And there's also a small lesion at the apex there. Okay, this is a very close friend of mine. I'm not her dentist. She is very traditionally minded dentally and medically. She now has another root canal treated tooth. She now has been diagnosed with autoimmune disease, and she's 45 years old. I don't know that she's going to do anything about it. Doesn't hurt, she said. Look at this. This is the same patient. Look at the lesion on the distal root. See that? Somebody really worked hard. I mean, holy cow, they got 3 canals in the mesial root. But guess what? We still have a failure here. All right, look at this. Again, not a big lesion. Look at the mucosal lining of the sinus. Is this a coincidence? I don't really know that this tooth is causing that, but it certainly looks suspicious. Look at this now from the axial view. See the sinus inflammation. Look at this around the root of the tooth. That's not normal. That's not healthy. That's an abscess in my book. This is another root canal, treated tooth with a failure. Woman came in about 2 months ago, and right off the bat, I was taking her health history, and she happened to mention to me that she said, my daughter, who was 4 months old, died last year. And I wasn't trying to be a psychiatrist, but I put my hand on her arm and I said, are you still carrying guilt about that? And I'd forgotten. She looked at me and she smiled and she said, yeah, I'm dealing with it. I'm a psychiatrist. I found out later that she got the biochemistry award when she was in medical school. Very bright girl. She went back, did an autopsy on her 4-month-old child that's dead. She came to the conclusion that her child died because of excessive vaccinations. She's really gotten on the bandwagon. And now, you know how that happens. Now she's also interested in her own. So when she started opening up that door and that window, she found, like we have found, there's a whole world out there. So when she got interested in vaccinations, then she got interested in holistic health, and she, like a lot of us, I don't know about all of you, but I absolutely believe that the traditional medical model was the correct model 30 years ago, and it took some failures to find out maybe that's not it. Okay, here she is here. See the radiolucencies around those from an apical view?